A former Virtua Health nurse in South Jersey is sharing her story with Eyewitness News tonight after she was fired for wearing her own personal protective equipment from home. As Kimberly Davis explains, she wants the community to know what they cannot see behind the scenes.
Dawn Kalak is a mother of a 10-year-old son as well as a registered nurse. Dawn was an employee of Virtua Voorhees Hospital, but after coming down with pneumonia, she was sent home to self-quarantine. On March 31st, she returned to work with her own N95 mask and surgical mask to fight in the battle of COVID-19.
When I arrived on the unit, I was given a white surgical mask, and it was quite possibly the thinnest surgical mask I've ever seen. It was probably comparable to tissue paper. And I was told that that mask was going to be my mask for the entire day.
Dawn tells me instead of using the mask that was given to her, she wore her N95 mask from home and put her other surgical mask from home on top of it, as well as the gloves she brought from her house. That's when Dawn says her floor manager told her to take off her PPE.
And I refused. I told her that I didn't feel comfortable, especially where the virus wasn't contained on the unit. And she said that she would have to speak to my immediate supervisor, and I told her to go ahead, that was fine, but I'm still not taking it off.
Later that day, Dawn was reprimanded by her supervisor.
I promised my son that I would protect myself and him, and I'd like to keep the mask on, and she told me that she strongly advises me that I look into a different career choice. And then she told me to clock out and go home.
On April 9th, Dawn had a meeting with her union and Virtua Health leadership. Dawn says during that meeting, she was told she could bring her own mask from home, but would not be able to bring her gloves or wear gloves provided by the hospital and shared workstations on COVID-19 floors. Dawn also claims Virtua Health is not providing healthcare workers with N95 masks. At the end of the meeting, she was left with two options, either resign or be terminated. She would not resign, in which she was fired.
If these hospitals don't adequately protect us, we are going to be harming other people by spreading this virus.
Virtua Health sent us a statement reading in part, as flexible as we have tried to be, we do have to draw the line when individuals say that they won't follow our safety policies. Such disregard puts all of us at risk. Dawn says she still wants to help in the fight against COVID-19 and hopes to be employed again soon. Reporting in Philadelphia, I'm Kimberly Davis, CBS 3 Eyewitness News.